Here's your scenario. Take a moment to read it and then let me know when you're ready to proceed. Okay, I'm ready. What's your differential diagnosis for wheezing and dyspnea? Given this patient's history, I'd be most concerned about asthma as well as possibly COPD, but other things that could cause dyspnea or wheezing could be cardiac asthma, which is actually left ventricular heart failure. It could be upper airway obstructions like laryngeal edema or tumors in the upper airway. You could also have bronchospasm or chemical pneumonitis or eosinophilic pneumonia. How common is asthma in this country, and do you know any risk factors associated with the disease? The prevalence of asthma in this country in adults is about 8.7%, and in children it's 8.2%. It can happen at pretty much any age, but there seems to be a peak incidence around ages 5 to 9. And I can think of about 4 risk factors. One of them is modifiable, and that's smoking. 3 non-modifiable ones are going to be income, ethnicity, and environmental factors. How does the pathogenesis of asthma work, and how does it differ from COPD? Asthma is characterized as a reversible narrowing of the upper airways in response to some sort of irritant and hypersensitivity to those airways. COPD, on the other hand, is non-reversible, and it also has hypersecretion of mucus, ciliary dysfunction, and lung hyperinflation. What's a typical ABG look like for someone who's having an acute asthma attack? Hypoxemia is probably the most common finding. Patients tend to breathe faster and develop hypocapnia because of this. Hypercapnia is a late finding and is concerning for status asthmatic